right side. I'm going to be contralateral. So just kind of getting in your head the medius versus the piriformis. If you can get that distinction, then the Maximus one's pretty easy. So just quickly, the piriformis motion is more towards the opposite foot, and then the medius is towards the opposite shoulder. So those are the kind of differences in the motion. So for piriformis, we're going to have her foot just lateral of midline in the setup. The contraction phase is going to be her pushing her AVI ducting and relax. And what you want to be focusing on or picturing is kind of kicking that head of the femur out and then bringing the leg across so that you're really stretching that piriformis. So that can be done by, I probably need my table a little lower, but that can be done by pushing down and then bringing it around. So that's what I mean by you're bringing it to the opposite foot. So you're pushing in, getting that head of the femur out of the way, and then really stretching. Sometimes there'll be some pinching in the groin area, and if that's the case for this or the glute medius, just try to reposition a little bit and see if that a different position will feel better. Another one for the piriformis is the figure 4, so it's like the Faber, and she's just going to do a figure 4, and then you can facilitate this stretch. Either have her come to the end so you can reach her better, or push in, and then you're going to pull, stabilize the knee here. So this will be getting her right side as well. And then the medius, doctor is on the contralateral side as well. So the piriformis, we're kind of moving that way. The medius, we're moving up to the opposite shoulder.
How do we contract the piriformis?
She's just, we have her push against me here. So we're just going into abduction, and that's for both of them. So for medius, same thing. We're having patient go into abduction and relax, and then we're going to be giving a little stabilizing pressure and moving across to the opposite shoulder. So you can see the difference here. It's here versus pushing in and going across. That one kind of confuses y'all sometimes. So pushing in and going to the opposite shoulder. Again, contraction is just having her abduct. For both of them, really, they're both lateral rotators. And yes?
Sorry, so can you do favor for this one too, for medial?
I think I would probably get the medius as well. Yeah, you're not isolating the piriformis only in the Faber.
Is that okay to do for the task?
Show us, no, I guess the answer is no. So show us, yes and no. Show us both. Say here's one, but I also would do this one. So this is the one the Faber is easy. So I want you to know both of them. But in real life, use the Faber stretch if that makes sense. So for Maximus, really easy. IPSI, you're going to same shoulder. So the contraction phase is just having her push basically into extension and relax, and then just taking the leg to the same side shoulder, stretching. Most people don't have this problem. We're sitting in a chair in that position all day long. So this is rare that we need a glute maximus stretch. But if they do have a knee issue, make sure that you're grasping below so that you're not bending the knee into deeper flexion. So again, medius, piriformis, opposite foot, glute medius, opposite shoulder, glute maximus, same ipsilateral shoulder.
What was the contraction for that?
For this, she's just going to push into me. So she's like extending, putting her leg into extension. So if that bothers her, then you can kind of grab here and do that. And then go into the same side shoulder for the stretch. Good.